My name is Dr. Khainza. I'm consultant anesthesiologist, intensivist, and healthcare manager. My primary job is to work as an intensive care and anesthesia specialist, but I'm also a teacher, mentor, and participate in the management. I've worked with Case Hospital, I would say, since the inception. I remember 1995 when we still had the small theater, would come in and do some operations there. And then later I joined as a full-time in 2011. And since 2011, I've been here. My main job has really been to develop the Department of Anesthesia and Critical Care. Yeah. So what do I love about my job is Case Hospital has given me the platform to practice what I've learned. So I've had to grow my skills, and as Case has grown over time, I've also grown with it. I've also managed to develop very many skills of the young doctors, because I'm proud to say that I have 8 young doctors of mine who have become specialists like me in my field, and that's a very big achievement. I've mentored quite a number of nurses, and then the biggest achievement for me is to see Case Hospital grow from a 3-bedded ICU to what we have today, which is a fully set 8-bed ICU, a separate NICU, and a separate emergency department. So that's really good for me. I work in a department. If I were to work on one patient at a time, in the intensive care, I would see about 5 patients a day, 5 to 8 if we are full. That's a day. And then in the operating theater, I would operate maybe also about 5. But because I've told you that we have grown, so under my care, we have an intensive care which admits about 50 patients in a month. And then in the operating room, we do between 200 to 300 operations. So all that under my eye, I think that's a big achievement. Now, unfortunately, I don't have set plans. I usually start at 6 a.m. by making calls to see how my house, I'll say my house is. So I would find out how many patients we have in the intensive care. Is there any who is critical? Is there any who needs my attention? And then have a look at the operating theater list. So that's when I emotionally prepare for my day. Sometimes they may call you that, oh, this patient is really bad, and I would have to start my day as early as 6:30 in the morning, or even earlier if they call me. So when I come in, I would first start from the operating room and check which cases we have. If there is any that is challenging, I would stay in the operating room and make sure that is started before I go up to the intensive care unit. Now, if it's a really challenging case and needs more help, I would call my fellow specialists to come work with me. If it's stable and the team can manage that, then I would go over to the critical care unit and join the round that goes on there. So we'll see, start with the patients, start with the difficult ones. We'll see the difficult ones, we'll see the needs. You know, for us, we work backwards. We are not like a doctor who is downstairs asks you, what is your pain? For us, we look at what the monitor is telling us. So if I see that your heart rate is going too fast, it's the first thing I'm going to start with. If I see that you're not breathing well, it's what I'll start with. So it's problem. Ours is really problem driven. Oh, Case has done so much. We've had so many fasts, and one that stands out is we had a patient, I think he was at about 80 or so, who had a blocked artery the main blood vessel which takes blood to the brain. And we had to put together a team that helped us do that surgery. It's called endarterectomy, and that was the first ever done here. It was a very delicate procedure, but we successfully went through it. The patient went on to live for more than 10 years, and that was really a big success to us. Now, the other big success story was the COVID. During COVID-19, it was so scary. Remember, most of the patients were being looked out in Mulago. Unfortunately, we were overwhelmed. Mulago was not taking in people, so we had to start. And we had the biggest private COVID center. We had a very big success rate. Most of our patients survived, both old, young, and that was really big for us. Then we are the best at handling emergencies. If you come in with multiple trauma, we have the whole team around here. All the surgeons are here. The best anesthetists are here. We easily get supplies. So to me, if you're very sick, and if you ask all the other hospitals, if you're very sick, CASE is the first place to go. We are all patient advocates. And for me, when I treat someone, I want to treat that person as though it was treating my mother or my son, or the way I want to be treated. So the first thing I want you to know is that you are in the best hands. I'm here for you, and we are going to take good care of you. And they all attest to the same. They all give the testimony. They feel at home when we treat them. We give them the best that we have. And we also tell them that in case what you need is not here, we will get it for you wherever it is. So we tell them, rest assured, you'll get the best. To me, being a good doctor is to fulfill the purpose that God sent me here for, to care for his people. And that's it.